what about in number 10? This was, you said doubling the science budget was part of the deal that you did with the Prime Minister when you came in.
Yeah.
You're no longer there. Is there enough support for this in number 10 to help Ottilie Liza and Phil Duffy in the Treasury pursue the de-bureaucratisation you describe?
I don't know is the answer to that. I mean, I hope that as the country emerges from the current lockdown and as as there should be an urgent, very, very hard look by this building into what went wrong and why in 2020. One of the most obvious lessons of that is this problem. It's the incredible value potentially in getting science and technology stuff right. The disaster that can come if you don't get it right. But also, I would encourage people to think about. It's not coincidental that the vaccine program worked the way that it did. It's not coincidental that to do that we had to take it out of the Department of Health. We had to have it authorised very directly by the Prime Minister and say, strip away all the normal nonsense that we can see is holding back funding in the therapeutics.
You say we took it out of the Department of Health. Who was we?
Well, in the sense that number 10 took it out of the Department of Health back in. So in spring 2020, you had a situation where Department for Health was just a sort of smoking ruin in terms of procurement and PPE and all of that. You had serious problems with the funding bureaucracy for therapeutics on COVID. So that was the kind of context for it. Patrick Vallance then came to number 10 and said, this shouldn't be run out of the Department for Health, we should create a separate task force. We also had the EU proposal, which looked like just an absolute guaranteed programme to fail debacle. And therefore, Patrick Vallance, the Cabinet Secretary, me, and some others said, obviously, we should take this out of the Department for Health. Obviously, we should create a separate task force. And obviously, we have to empower that task force directly with the authority of the Prime Minister. At that time as well, you had some very smart people saying, people like Bill Gates saying, don't do this in a normal way. Start building, like the Apollo program, actually, exactly like that. Learn the lessons from that concurrency. So start building things like the supply chains and the manufacturing capability now, before you do. Normally there's a kind of sequential thing. You figure things out, and then you do tests, and then you do manufacturing and distribution and everything else. What Bill Gates and a lot of other people said was just try and smash all of these different things together and try and do them in parallel. But to do that, you needed to have a different structure.
Well, we look forward to going into more detail in that as part of our lessons learned inquiry with the Joint Committee with Health and Social Care. On the science funding system as we have it, let me turn now to some of my colleagues, starting with Chris Clarkson.
Thank you, Chair, and thank you for coming today, Dominic. So, obviously, you've already sort of focused on the fact that, that there's a serious problem with bureaucratisation, and I love the word bureaucratisation. But how effectively do you think the R&D system that currently exists, including UKRI, is working in the UK? And what's actually working and what isn't working? Because we've already talked about this very vertical structure and having a much flatter structure for ARIA. What sort of key takeaways are there from what's already there about what doesn't work?
So you slightly sort of cut in and cut out there, I'm afraid. So I couldn't hear brilliantly what you said. I think what you're saying is kind of what's wrong with the current system around kind of university funding and UKRI and stuff like that. So essentially you have the output that everyone is looking for is pretty much identical, which is metrics like, is this going to be a paper, and is it going to be a paper in a high status journal like Science and Nature? The decisions are all basically made by peer review committees, and this forces decisions very, very much to conservative, cautious, incremental ideas. It's why I said earlier on that David Deutsch, one of our great physicist pioneers of the last 50 years, says he could not get funding now for his ideas from 1980 in the current system. And the people who approved this funding then say that there's no way that they will be able to do it now. So you have everyone's looking at these same metrics. You can't have software as an output. You can't have a tool like Arxiv as an output. You have the same kind of peer review committees looking at everything, and all the different entities that you go to basically operate in exactly the same way. There's no one that you can go to and say, look, what I'm doing doesn't fit into that, into a standard metric. Obviously, last year, we saw the Department for Health had just absolute total disaster in terms of buying, how it buys, how it procures, how it deals with science and technology. It's why we had to take the vaccine process out of the Department for Health. Yeah. But I don't think that means. I don't think that leads you to the conclusion that you make the Department for Health the client for ARIA. I think ARIA should be broadly defined. It should be able to look at challenges and problems across the whole domain of science and technology.